And so with that, we can go ahead and get started. I know we'll probably have other folks joining us as the hour goes on. My name is Olivia Orndorff. I'm the Chief of Staff here at the National Resident Matching Program, and I'm joined by Dr. Alec O'Connor and Dr. Jennifer Swales, who will have introduced themselves now. Alec?
Hi, everybody. I'm Alec O'Connor. I'm a former program director for internal medicine at the University of Rochester, and now I'm an associate DIO for the clinical learning environment. And I helped direct a study that looked at in-person visits after virtual interviewing a few years ago that will be part of what we talk about.
Hi, everyone. I'm Jen Swales. I'm also a former program director, current vice chair for education, and part of the NRMP work group that helped design this pilot.
All right, so just a quick overview, a couple of slides here on what is the voluntary ROL Lock. And then as we're kind of going through this, as you're thinking of questions, would really encourage you to go ahead and start using the chat to just put those questions in. Because once we get to the end of these couple slides, we'll start going through those questions. So that way we can be responsive to what you all need to learn about the pilot. So the voluntary logging functionality for programs and their rank order list was really designed so that way programs can choose to participate in this pilot and they'll be able to lock their rank order list as soon as that certification process opens in February 2nd. So that way they can have the opportunity to have post-interview in-person visits. So any participants of their interviews, that applicants that want to come can come and visit if they want to or not, knowing it won't impact their ranking by the program. So to help facilitate this, there is going to be a lock functionality in NRMP's R3 system. So that way folks can lock it securely. Applicants can go in and see that those programs have chosen to lock. They're also able to go in and see if programs are choosing to participate. Because the whole process of this pilot is to have that locking functionality. Once the ROL has been certified and locked, it cannot be changed. The ROL is locked and that's the way it will work. And then we'll also go through where you can sign up if you're interested in signing up for the pilot. So this slide here is just kind of giving you an overview of the overall timeline. We also have this on our website on the process document. So if you want to take a look at it later, we do have it there as well. So we're in the phase of you all getting to sign up if you want to participate in this pilot. It is an opt-in functionality. So if you want to participate, you do have to go in and sign up at every program track level. So you are able to decide if you want to do it for both your prelims or your categorical, or if you just want a specific track to participate, you can make those decisions. For internal medicine, the deadline is coming up. Your specialty did decide on September 5th. So if you want to participate, you will want to go in and make that decision in R3. Once you've decided if you're going to participate or not, for those participating, when it comes to interview time, you will want to make that information known. You'll want to think about how you want to confidentially collect those RSVPs for interviews for interviewed applicants that may want to come. And really what happens then in February is you'll want to make sure you're locking your ROL once that certification becomes available, with the idea being you'll lock by February 9th, or at least 24 hours in advance of that first visit, whichever comes first. And that February 9th date really is because there's only so many weeks between that and certification deadline of March 4th when the applicants will need to get their ROL in. So the idea being those in-person visits would happen kind of in those early to midweek of February to make sure they're there and present before the ROL certification deadline. And then we have match week on March 16th. In participating in the pilot, we would be sending you from the NRMP a survey so that way we could kind of understand what worked, what didn't, and all of those good things there. So for those that are interested in how to sign up, to say yes or no, however you want to set that, it is going to be in NRMP's R3 system. So you'll go to those participation details for your program. So when you log in, you got that home screen, you can click on the program track level, get to your program details, and there's a voluntary ROL Lock participation screen. So you can click the yes or no there and then click save. And then this is just what applicants see when they go into search. They can check and see if a particular program is participating in the ROL lock. Once we get to the actual locking of that ROL, they'll be able to check that there as well. And then this last slide for us, so hopefully the chat is starting to populate with some questions about the overall ROL lock. It's just really where you can check out some additional resources. You can also always, of course, contact Pilot at nrmp.org with additional questions. But just to let you know, we're going to post the recording of this there. We also have FAQs in case that's helpful, so you can learn some more about different questions there. If you know you have contact with any applicants and they're curious about it, you can always send this to them as well, this FAQ. And then also, Alec, I'm going to put you on the spot if you want to talk just a little bit about the study that we're highlighting here as well.
Sure. There's a great question in the chat of have you surveyed applicants about their opinion about the process? And that's all summarized in the paper that is referenced here. There's robust data that applicants don't like a virtual only process. They don't think that that's the ideal approach. Only 4% of applicants, IM applicants, answered that a few years ago when we had a really robust survey. And you can think about how hard it would be to make the leap of faith to go work somewhere in a residency program for at least 3 years, having never been there, which is basically what we're asking people to do when we have virtual interviews only. Equity is a big concern, so you want to have the same process for all applicants, and you want to be as accessible as possible. So there's a lot of reason to have virtual interviews. But it would be lovely if applicants could also visit a program before they had to fill out their rank list. The problem with doing that is that applicants can't all afford to go to all of the in-person visits they might want to go to. There's a strong feeling that they are being judged, and if they don't choose to go visit a place where visits are possible, that they're going to be ranked lower. And so this pilot study that we did explored a process where the 6 participating programs, and these are a range of programs from large university to small community, all agreed to do virtual only interviewing to lock their rank order list in the beginning of February, and then allow in-person visits for applicants who wanted to visit after the program had finalized and locked its rank list. And that allowed a window of time where applicants could visit if they wanted to without feeling like they had to visit, or if they didn't visit, it would harm their rank position. So it really created a very clear no stakes window of time for applicants to potentially visit a program in person before they finalize their list. And so that happens in the month of February. We surveyed all of the participants in this study, and it's summarized in the paper. That included applicants, program directors, program administrators, and all of them felt like this was a great approach that we used, where the program locked its lists in the beginning of February and created this no stakes visit window opportunity for applicants. But what also became clear is that applicants don't trust program directors not to change their rank list. So in our study, almost half of the applicants who we surveyed, and this was an anonymous survey, thought that the program directors might still change their lists depending on whether they visited or not. And that was despite, our IRB oversight and the DIO's oversight in the participating program. So upshot is that we have done a lot of survey collection, and this is a favored process. The applicants really loved this process, but still didn't trust that the participating programs in the study wouldn't change their rank list. And that's why the NRMP has now allowed a pilot for a formalized process where programs really can't change their list in the month of February, dependent on applicants' choices to visit or not.
Thanks, Alec. So like, as you mentioned, that survey is included kind of in the overall article that we've got here. So we'll put the links to those two so that way you all can access those as well. And I really encourage everyone to take a look at the paper Alec is mentioning there, because it does kind of talk through process and surveys. And then I would also say, kind of in response to Stan's question that we're getting on have you surveyed applicants about their opinions on the process, part of the work that NRMP did from NRMP's side of things is we did a public comment out to the community, which included applicants on what the approach should be. because we initially got this ask from OPTA on considering it really during the pandemic. And then in addition to that public comment during our kind of match summit that NRMP did in December of 2023, which had program directors, medical school officials there, as in addition to our learner groups, we again asked kind of the learners in addition to the program side, you know, what do you think about this process? Is it something we should pilot and just see? So it's a great question, and it's one of those things where we'll also be evaluating applicants during this pilot as well to see what they thought about it, because we want to make sure it's something that works for both programs and applicants. And really for the applicants, what we heard is there was a piece of wanting the locked list, especially if we're doing the interview process of virtual interviews with the in-person visits. So from the NRMP side, we took kind of a little bit of a different approach in how we asked for those comments, but it is something we also wanted to ask about for sure.
I have some questions that were submitted online. I don't know if people have more questions they want to put in, but I'm happy to ask them if now is a good time.
Yeah, I think let's do it, Jennifer. And for folks on the call, please keep putting your questions in the chat and we'll answer them.
Okay, so you guys already addressed one of them, which I think people should put in the chat if they don't think it was fully addressed, which is we've been doing site visits for several years and our applicants seem to believe that our list is locked prior to the visit. Why do we need to enroll in the pilot? And I really identify with that question because I felt the same way when I was locking the list. I thought the applicants believed me, and it's only been by listening to you guys that I came around to not thinking so anymore. I guess the next question is, what if my impression of an applicant changes after the interview day, or someone is really kind of having a hard time? What do I do? And if I change the way that I want to rank them?
Yeah, I can speak to that. It's certainly a theoretical possibility. We, in our study across the 6 programs, we had 1,800 applicants that participated in the study with the 6 programs, and that didn't come up for any of the 6 program directors to feel like, oh, I wish I could change my list now after the in-person visits that happened. But it still certainly could happen. Anecdotally, we have felt probably more like we would have moved people up on the list based on in-person visit interactions. But that really wouldn't be fair because then we would be rewarding people who were able to come and visit. It's not equitable then if you are going to change your rank list if and when people come and make a good impression. So then that's not really equitable to change your rank list after somebody comes for an optional visit and it's not really a no stakes visit. On the flip side, if somebody came and really was unprofessional or couldn't communicate effectively, or you discovered things that you wish you knew from the virtual interview, unfortunately, you can't change your list with this process. And I still think that's appropriate. If you hadn't had the in-person visit, then you wouldn't have known that information that came out in the in-person visit, and they would have just arrived at your program. But also what I would say, if somebody really demonstrated egregious behavior, then you would have the opportunity to speak to that person either during the in-person visit or contact them after the visit and say, we noticed this behavior that's unacceptable in our program. Just FYI, our rank list is finalized, but you will we'll be watching for further evidence of unprofessional behavior if you do actually match in our program. So it gives you sort of, additional warning, and it gives them the opportunity not to rank you at the top if they have other options. So that's, I guess, the long-winded answer of saying that unfortunately you can't change your list based on in-person visit observations, but I think that's the equitable approach anyway. I don't know, Jenna, you've been doing this too. Have you had experiences where you've had people that you wanted to change the list for?
No, I think same anecdote is that most people, if anything, want to move people up on the list.
Yeah.
And I think that was similar to the data that you have in your paper.
Yeah.
Let's see. So then there's a bunch of questions about the deadlines, which I know you've already covered, Olivia, but I'm going to ask you these questions anyway. So what happens if we miss the deadline on September 5th? We have a lot going on, and that is very soon.
Yeah, and I would just say, would really encourage folks, if they want to participate, to take the couple minutes, go into R3 and click yes by the end of day on September 5th. And I would also say, you know, if you're not able to participate this year, it is a 3-year pilot. So you can always do it next year if you think the change management is a little bit too much for you this year. But would really encourage folks to go ahead and go in because that is the deadline that's been set. So we really want to make sure that we can also communicate effectively to applicants that after September 5th, you can go in and see which programs are participating and which ones are not. So that would really be what we would hope folks would do, is go in and say yes if they want to participate. Really because also, you know, the NRMP is hoping this answers a need the community identified that they wanted. So we'd really love to have folks participate.
Okay, and so then if we go in and we say yes before September 5th, but then we are unable to certify and lock our rank list before February 9th, what happens?
So from the NRMP side of things, if you don't lock by February 9th, you would still need to go in and certify by that March 4th deadline. So you would still need to take that step. If you're unable to participate and you've said you would, you've identified that to interviewed applicants, it would really be in the best interest to then let applicants know in the change, right? So that way they can make the decision if they still want to come knowing that list isn't locked, or you know, so they can take that into consideration when they're looking at all the different program things. If it's more a functionality issue, right, like you're having issues and you're not sure how to do it, you can contact our NRMP support team and we'll make sure that you're able to get it certified and locked by that deadline, if that's what you are trying to do and are just struggling with the system.
Okay, but the certification deadline doesn't change, so it's not like
Correct.
your empty list gets automatically submitted and you don't have any interns, right?
Right, you would still need to take all of those steps. It's just if you're participating in the pilot, you then have the opportunity to lock it, which is a second step to the certification, right? Like you'd have to go in, you'd have to put your password in, all of those good things. So that way you're not locking by accident, but you would still need to take that step of certifying, even if for some reason things have changed and you're no longer able to lock.
Okay. And the applicants would just see in R3 before they came for a visit that you had not locked since
Correct.
you.
Yes, they would see that you had signed up for the pilot and they would see that you had not locked if you choose not to lock by the deadline.
Okay, that makes sense. And then Alec, why do you think this is important? Why did you even get involved with this project?
I just think this is the right thing to do. I think it's such a challenging decision for applicants and they feel overwhelmed and there's a lot of rumors about this and that and, you know, things posted on different Reddits and websites and things, and they're trying to get information about the trust that they need to place in a future program. And there's so much information that they don't have access to, and it's such a big decision that I don't think it's really fair for them to be stuck relying on a virtual interview and, you know, online resources. I think that going and seeing a place and picturing the place and understanding the location, but also meeting people in person and getting a feel for the interactions with people in person, it's just different. And it's such a high stakes thing. We don't really ask applicants to join any other kind of job without an in-person visit. And, you know, there's a reason that we're still doing virtual only interviews. And I think there's a lot of reasons. And I think that they are the right reasons to do interviews that way, as opposed to the old model where everything was in person. It was very inefficient and very costly and not equitable either. So I think I really think that the ideal way to do this from an applicant perspective really is what we're narrowing down to trying to do here with this pilot, which is to have a virtual interview and then a formalized process that completely locks down the program's rank list, and then a no stakes opportunity to visit if they can and they are interested. I just think it's the right thing to do for applicants.
Yeah, this might be selfish, but one other thing that I find useful about it is that it cuts down, it cuts down on the cost of the second looks. you know, and some of the fatigue of a second look. You know, if you have a second look where all the applicants are trying to audition during that second look, or they're coming to try to get moved up on the rank list and not because they actually need the information, you end up spending a lot more money on this look, and you end up spending a lot more of your energy if you choose to even go to the second look. You have to like avoid going to the second look. You can't recruit the same way during it. By transparently locking the list, I think it makes the second look visit a lot cleaner, a lot easier, and potentially a lot less expensive, which I know is program director centric. And I appreciate, Alec, how applicant centric you're being, but I think that it's a little bit of a win-win from that perspective.
Yeah.
Okay, I am almost done with my questions. We just got one in the chat. Does the survey ask the applicants what they are looking for in their second look visits?
Looking for it. Okay. So it asked them essentially like, did you find it useful? Did you find it helpful? Did it impact where they ranked it on the rank order list? We also have some questions where it's like, do you think this should be done this way next year? Are there things you think that should be done differently? So we do get at that question in a couple different ways in terms of how we're asking that evaluation question.
That'll be for the people that participate in the pilot this year. In our study, we did ask applicants what the reasons that they chose to attend an in-person visit, and the rank order from most frequent to least frequent was to see the hospital clinic facilities, to meet the residents in person, to meet the faculty in person, to learn more about living in the city. Those were by far the most chosen options. So it's kind of what you would picture, I think. What we did, and our paper also summarizes how the different programs approached these in-person visit days, how we structured them. We set them up a lot like our old recruitment interview days were back when we could do that. And so there was a, for the people that came in person, we had a dinner with the residents the night before that was a very informal, social, fun gathering. And the residents actually really enjoyed it. As well as the applicants. We had the applicants come to morning report. We had key faculty give, and we're still doing this, have the key faculty give overviews of different parts of the program that might be of interest to the applicants. And most of that stuff is all really on the website and on the online resources for all of the applicants. So it's not new information, but it's giving them the same information again because they seem interested. And then we have tours of the hospital and the clinic facilities by residents. And then we have a lunch with the residents. And then we have an optional, I think it's a self-guided tour of Rochester where we are, because most of the applicants who are choosing this kind of opportunity haven't been in Rochester. So they don't really have an understanding of where the residents live and what's the town like and what are the different things here. And upper 90% of all of the applicants that across the 6 programs in our study that chose to do one of these in-person visits felt like it was highly useful to them in making their final rank list. And almost the large majority, they were moving the program up on the list. It wasn't that they were, finding it really helpful to cross this program off the list. So there is a little bit of self-servingness that you could see in the opportunity where you actually might show people a town they've never been to and a, great community that you have in your hospital, clinic, residence, and also in the actual city that they maybe otherwise wouldn't have necessarily taken a leap of faith on if they'd never been there. So hopefully that answers the question that you had.
And I'll just say, feel free to keep putting questions in the chat. We did have another one come up about tracks. So asking if, one program track opts to join, the other tracks didn't, an applicant applied to the tracks, both those that joined, those that didn't. If we could just talk a little bit about that. I would just say, again, you can pick at the program track level. So that is, again, what they're saying can be done. You can choose which ones you want. And an applicant is choosing to apply to different tracks. I think this goes a little bit in line with just how you're communicating the information in general about how the tracks are different or what they can expect there. But I'll let Jennifer and Alec opine on that since they probably have more experience in how that goes.
We've tried to use the same approach across all of our tracks, but there are some differences. We have a ABIM accelerated research pathway that has some unique challenges with it that I could see a program wanting to carve that out. The prelim lists I think of as being much less high stakes from our perspective, and I think from the applicant's perspective, they're important, of course, but they rarely want to come visit a place they haven't already been for this purpose for the prelim year. They're going to be much more interested in PGY2 year. So I don't think the prelim list, in my perspective, is really necessary to include in this, but you might as well just get the list done. There's a lot of upside to having the list finalized on a specific date that's early, and then you don't have to worry about it for another month. So there is some benefit of that. I don't know if you guys have taken things different approach, Jen.
Yeah, I mean, for me, I think the prelim list, of course, I love to have my match list done. It feels incredibly good to have it uploaded and certified, because then my nerdy nightmares can cease. But I do think also that the prelim list has some special situations related to early match candidates that sometimes I have to consider. Related to people who might not match in urology or something, or ophthalmology or something, and then I end up considering them late, and I'm trying to figure out exactly what that prelim list might look like. So I think it was very important that the prelim list be separate, and I personally very much appreciated the NRMP was willing to list tracks each very separately. I also know that sometimes primary care tracks can take a little bit longer to figure out exactly which applicants are interested and to review those applications. So I think they all need separate consideration. And for me, prelim tracks probably might not need to participate in the pilot or have the site visits.
And I think that it just goes back to, especially when, you know, they're being invited to interview, just making sure that you're very clear on all of that good communication there, on just which tracks your program is participating in, and how they can choose to RSVP if they're doing it and which tracks aren't. So I think it just kind of goes back to that strategy there in terms of the interview. I know we've had some people jump on a little bit late, so just want to encourage everyone to put any questions that you may have in the chat about this pilot. And then otherwise, if folks got what they needed, you know, we can always close out a little early. Don't want to take people's times if they don't have any questions, but right now we don't have any questions in the chat, and we're kind of coming to the end of the questions that were sort of submitted in different venues. So maybe we'll give it a couple more minutes here, and then if we don't have any questions, we can close this out a little early and give some time back. But let's just wait here. Maybe the silence will drive it. I don't know.
People can also post on the forums if they have questions, and make sure we get everyone's questions answered. So I'll put the recording on the forum. You guys will send it out too, right?
Yes, we will send that forum out, excuse me, not the forum, the recording out as well, so people can see it. And I know we've had some folks drop off, so thanks everybody for joining us. I think we can call it wrapped up, and feel free to reach out with any questions. And thank you, Jennifer and Alec, for taking the time for this Q&A, and hopefully everyone found it helpful.